Welcome, everyone, and thank you for attending the American Head and Neck Society Head and Neck Cancer Alliance webinar, What to Expect During the First Year. I'm Amanda Hollinger, and I'm honored to serve as Executive Director of the Head and Neck Cancer Alliance. And I wish to thank Dr. Jason Rich and our Head and Neck Cancer Alliance ambassadors, Tina Odell and Melvin LeBlanc, for taking part in this webinar discussion today during our Oral Head and Neck Cancer Awareness Week. So thank you for joining us. A few notes on today's format. Our three panelists will share information and their stories with you. Following their presentations, we will then open it up to the audience for questions. Please feel free to ask questions during the time they're speaking as well, using the chat function or the Q&A. And just a reminder that as you're chatting, feel free to introduce yourself and make this interactive. But do switch the chat to all panelists and attendees if you'd like everyone to see your comment. Otherwise, you can just limit it to the panelists. Another option for participating is to raise your hand in Zoom and use the raise the hand icon on the bottom of your screen. And I will, when there's time, call on you to ask your question out loud. So first, I'd just like to do a brief introduction of the presenters. Tina Odell is a mother, former Marine, and survivor of HPV-attributed head and neck cancer. She lives in Duluth, Minnesota. Tina's cancer journey began in January 2015 when she noticed swollen lymph nodes on the right side of her neck. Over the next 6 months, and after several primary care visits, Tina monitored the swollen lymph nodes. And a visit to the local ENT and 4 biopsies later, she was sent to a head and neck surgeon's clinic where she was diagnosed with HPV-attributed stage 3 squamous cell carcinoma of the head and neck. Melvin LeBlanc is a husband, father, Shell Oil Company executive, Air Force veteran, and survivor of tongue cancer from Houston, Texas. In May of 2018, he visited 2 clinics undergoing 5 needle biopsies to investigate a lump on the right side of his neck, resulting in inconclusive results. Melvin then went to MD Anderson in Houston, and with an additional 2 needle biopsies, it was determined that he had metastatic squamous cell cancer, and the primary source was identified at the base of his tongue. He underwent both radiation and chemotherapy. Dr. Jason T. Rich is an associate professor of otolaryngology and head and neck surgery at Washington University School of Medicine in St. Louis, Missouri. He earned his medical degree at The Ohio State University. He completed an otolaryngology residency at Washington University in St. Louis, and his research activities are focused on head and neck surgery in the elderly population and head and neck cancer survivorship. He also serves as the associate program director. He and his wife have 4 children and love living in St. Louis. Thank you all for joining us, and I will turn it over now to Dr. Rich.
Well, it's a privilege to be with you this afternoon. I'm really grateful for the opportunity to be a part of this webinar. As Amanda mentioned, I'm a head and neck cancer surgeon. I've been practicing for about 10 years and have a passion for survivorship, helping patients along the journey. And here at Washington University, I help with others develop our survivorship clinic and a survivorship support group that has just been very enriching for many people, including myself. So I'm really grateful that I get to be a part of this. Now, Melvin and Tina are really the stars of this show. And so my role here is I'd like to just kind of lay down some groundwork, some basics about head and neck cancer, the treatment, some of the side effects. And then we're all excited to hear Melvin and Tina's experience. And then we're happy to answer any questions. So the head and neck is really a unique, head and neck cancer is unique. And I think it's one of the reasons why head and neck surgeons like myself have gotten interested in practicing and caring for patients with head and neck cancers, because it's an anatomically based a field. It's not just like a kidney or a liver. And so because there's so many body parts, the range of cancers is just tremendous. There's lots of different sites, there's lots of different cancers, and so there's a wide variety of what we take care of. So I just want to go through some of these. If I move my cursor, can you see the cursor on the screen? No?
I don't
No.
see it.
Okay, let me see here. Okay, can I draw here? Oh, well, we'll make it do without that. How does that sound? Starting on the left, the locations for head and neck cancer, we have the nasopharynx, which is at the very back of the nose. Just below that, I have listed the oropharynx, or what we oftentimes refer as the throat. This is the tonsils or the base of tongue. Cancers in this area are really on the rise because many of these are caused by the human papillomavirus. Smoking and tobacco is also a cause for throat cancer or oropharynx cancer, but the HPV-related cancers are really on the rise. Interestingly, the nasopharynx cancers are caused by another virus, many times Epstein-Barr virus. Moving over to the right of the screen, we also take care of advanced skin cancers, such as squamous cells and basal cell cancers, and even melanoma. Then there's also cancers of the nose and sinus, deep within. Oral cavity cancer or mouth cancer is also a very common cancer, head and neck cancer. This includes any type of cancer of the tongue, roof of the mouth, inner cheeks, gums, lips. Most of these are caused from smoking and alcohol use. However, not all of them are, not all patients with oral cavity have smoked or drank, but that's the main cause for oral cavity cancer. Moving down to larynx or voice box, larynx cancer is actually on the decrease, which is encouraging because the vast majority of cases of larynx cancer are caused from smoking. And so luckily, a lot of people are decreasing their smoking, and so we're seeing less and less. Also, we take care of thyroid cancer. Now, for my presentation, I'm going to be focusing in on just these 4 sites, which are the majority of the head and neck cancers and probably the majority of the cancers for those who are attending this webinar. Now, how do we treat head and neck cancer? Really, there's 3 main treatments, or what we call modalities, for treating head and neck cancer. There's surgery, radiation, and chemotherapy. Now, surgery, I like to divide surgery into 2 types. There's open, which is demonstrated by this diagram with an incision on the neck. That means that we make incisions on the neck or the face to have access to the tumor. Next to that, I show a picture of the Da Vinci robot. This is a minimally invasive approach where we go through the mouth to remove tumors of the throat, oropharynx, or the voice box. Now, many times patients need a combination of both of these treatments. And with the new advances with these minimally invasive robotic surgeries, we're able to do a lot of surgeries that we couldn't do before and help minimize the negative effects of surgery and other treatments. Now, radiation is also a very important treatment for head and neck cancers. And this is an example of somebody receiving radiation. Radiation is giving high-powered ionizing beams that you can't see with the naked eye to certain parts of the head and neck to help kill cancer cells. Radiation can be given either as the main treatment or as kind of cleanup after surgery to kill any residual cancer cells. Chemotherapy is an IV medicine. It's a systemic medicine. That's given through an IV that goes throughout the body to kill any cancer cells anywhere in the body. We use that both to try to cure cancer, but we also use it when we can't cure cancer to try to palliate or shrink or slow down the cancers. Now, it's important to realize that not every cancer is the same, the location as well as the size. As a general rule, When we have early cancers or small cancers, usually we just need one modality or one treatment. And usually this would be surgery or radiation. Rarely does chemotherapy alone cure a cancer, but for early cancers, usually surgery or radiation alone. However, when somebody has an advanced cancer or a large cancer, usually we need two or three. And that may be surgery and radiation, it may be radiation and chemotherapy, or for some cancers, it may be surgery, radiation, and chemotherapy. And a lot of that is dependent on a person's particular cancer, where it is, their health situation, and how large it is. Now, let's talk just briefly and generally about how we treat different cancers in the head and neck. So there are certain areas where the treatment is very standardized. There's one pathway. This is how you do it. Okay, and that's, for example, the nasopharynx. It's radiation if it's a small tumor, and if it's a bigger tumor, it's radiation and chemotherapy. We really don't operate in that area. Similarly, for mouth cancer, it's pretty regimented. Surgery is the main treatment, and then sometimes if it's more advanced, we may add radiation and even chemotherapy after that. Now, there's sites also in the head and neck where you could go either way, with or without surgery. And an example of that is the oropharynx or throat, or the larynx or the voice box. For example, for both of these spots, you could do surgery followed by radiation and chemotherapy if it's bigger, or sometimes you can give just radiation and chemotherapy. Again, there's a lot of nuances, and that's what your treating doctors are going to talk with you about, or for those that have already gone through that, they've already gone through that with you, and there's a reason why you may be directed to one or the other, or you may have been given a choice. But what we found through a lot of clinical trials is these are the best treatments that we have to date. And I'd like to take just a quick little moment to talk about clinical trials. Clinical trials are so important. The reason where we are where we're at is because at academic institutions like MD Anderson, Washington University here and other places, we've set up very carefully structured trials, which are it's different treatment options to try to test what's the best way to treat cancers. And so it's very important that patients are willing to consider clinical trials, because that's how we advance the field of oncology, and that's where we've gotten to where we're at. And as we hope that we get even more advanced and better through clinical trials. So if you've been offered a clinical trial, I encourage you to really consider that, because that's how we move forward. These are very safe. They're very well monitored. Nobody's going to have you do anything that's not safe. But again, that's how we move forward this field of head and neck cancer. Now, what are the long-term side effects of treatments? Well, there are some side effects that surgery and radiation both can cause, and that's swallowing difficulty, as well as neck pain and swelling. So patients can have difficulty swallowing liquids and solids, and I believe our ambassadors will be talking to you about that. But you can also have neck pain, stiffness, and also swelling, which we oftentimes call lymphedema. That's very common. Now, regarding surgery, in particular, you can also have changes in your appearance when surgery is performed. Okay, and this is not an exhaustive list of side effects, but I tried to hit the big ones. Regarding radiation, many times radiation can cause a dry mouth because it affects the spit glands, both in the mouth and the parotid gland and submandibular gland. So patients can have dry mouth, and that can result in more cavities, teeth not being as healthy, and also hypothyroidism. It can affect your thyroid gland. So if you've had radiation, it's important to have your thyroid checked regularly by one of your physicians, to make sure that if it starts to get low, you start getting thyroid hormone. Now, chemotherapy side effects, a lot of those chemotherapy side effects are nerve related. A lot of the chemotherapies that we use for head and neck cancer can cause hearing loss, even some balance issues. It can cause numbness of the hands or feet, and sometimes can cause kidney damage. Now, again, there's no treatment. Even a Tylenol has side effects. So I'm not trying to scare anybody, but it's important to realize that for us to be aggressive enough to cure a cancer, there can be side effects that come along with that treatment. Now, this is my last slide here. Whenever you're on a journey, say you're on a trip or a race or a marathon, it's important to know where your milestones are so you can pace yourself and you know what to look forward to. And so when I talk to my patients, I always like to give them some of these milestones so they kind of know what to expect. Not everybody follows these plans, but I think it's fairly standard. So first of all, if you're going to get the full gamut of surgery, radiation, and chemotherapy, it's about a good 3-month block of intensive therapy that you're going to be having. And so you really need to kind of set that time aside and focus in on getting your treatment and taking care of yourself. Now you start to recover after you finish your treatment. I like, patients tell me, when am I going to be back to normal? Usually patients are never going to get back to how they were before, but there's going to be a new normal. And I tell patients there's a lot of improvement over the first year. Usually after the first year, things start to plateau in terms of how much improvement, but a lot happens that first year. So I try to encourage patients to be patient, keep working with all of your care team to optimize your recovery from your treatment. Now, 2 years is a very special year because if a cancer is going to recur in the head and neck, usually it will happen within the first 2 years. So when you get to that first, that 2-year milestone and there's no cancer back, that's cause for celebration because you're in a good running that probably that cancer is not going to come back. At 5 years, if the cancer has not come back, we consider you cured. And so it's still important to be in touch with your doctors because sometimes there can be late-term side effects from your treatment, but rarely does the cancer come back after 5 years. Now, this journey may be overwhelming. It may be discouraging at times, but I like to remind people that you've got a full team of care providers that are there with you all along the way. And this is just a list of some of them. So please, as you move along your journey, whether you're at the beginning, the middle, or farther out of your journey, please remember there's a lot of people cheering you on and a lot of people that want to help you. So here's some resources for patients. And with that, I'm going to end the slide. And
thank you so much, Dr. Rich. That was very informative. We've had some great questions coming in that I'm going to hold just until Tina and Melvin have had a chance to share, but looking forward to further dialogue. Thank you. And Tina, do you want to go ahead and go next?
Hi, everyone. I am Tina Odell. I live in Duluth, Minnesota. As Amanda told you earlier, I'm a mom, I'm a Marine, and most importantly, I'm a Christian. And I will tell you, it was my faith that got me through my journey. So I would say, to start off with, have a faith, have something that you can hold on to, because that is the best part about going through this journey, is having that faith and having it move you forward. So I had surgery. I had 14 lymph nodes removed from the right side of my neck. My tumor was underneath my mandible. So I had a modified neck dissection. I also had a tonsillectomy, and they used a Da Vinci machine to shave my tongue from the top to the back. And they did not find the primary tumor. And with my surgeon and my oncologist, my radiation oncologist, as well as my hematology oncologist, they had a really difficult time trying to determine what the treatment path for me was going to be, because they were, from the data they were compiling, they were seeing that HPV caused cancer. If you just do surgery, more than likely you're going to be okay. But because they didn't find the primary tumor, they decided to do 35 rounds of radiation. And I had 35 rounds in a tomotherapy machine. And if you are not aware of what a tomotherapy machine is, it's a radiation delivering device that's combined with a CAT scan, so that when they bring you into the machine, they ensure you are lined up correctly, because they have to painstakingly track the way the laser is going to deliver the radiation into your head and neck. So don't be afraid of that. It is a big, scary machine, but you have a group of caregivers who will help you through that. They're an amazing team wherever you're at. Please lean in and trust your medical staff. They're amazing people. They love you. Don't ever doubt that. So at the time, my son was 15 and I was a lacrosse coach, and I lost my voice. I had thrush. I developed shingles. I lost my voice, and I couldn't swallow. I lost about 25 pounds during my cancer surgery, my cancer recovery journey. And it took me about 1.5 years to be able to taste, because my tongue regenerated its taste buds. So that was pretty scary. Also, for those of you that have to get radiation, I had to get my mask fitted twice because I lost too much weight and it would not keep me still. So that will happen too. And I'm sure that your care providers will give you some insight on that as well. Make sure you see your dietitian during your treatment, because that's very important. Because when you start to lose weight, you need to listen very carefully to their directions and how to move you forward through that. My side effects were I didn't have a voice for about 1.5 years. And that really scared me, because I'm a coach. I'm also a motivational speaker and attend a lot of symposiums. And I thought that I had lost my ability to do something I love, but it came back little by little. Still today, 6 years out, my voice fluctuates. Some days it's really normal. Some days it's really horsey. That's just my new normal, as Dr. Rich said. I also have hypothyroidism. My thyroid is actually dead, so I have to take levothyroxine every day. I have extreme dry mouth. So when I eat, I drink more water or fluid than I actually eat food. Those are the biggest things I had. And I will tell you this, for those of you that are getting ready to go into radiation, listen to your oncologist about the moisturizers that they give to you. Always use those moisturizers, because they saved my face and my neck from being burned. And this is going to sound really funny to you guys, but my dogs knew something was going on with me. And they licked my face from my nose to my collarbone every day when I returned from radiation. So don't be afraid of that. I know that sounds really weird, but that, I believe, was part of my healing journey. Not only did I have them help with the healing, they also helped me spiritually, because they loved me through it. So I would tell you, lean into those animals if you have them. And one last thing, well, a couple last things. Have patience and grace with yourself. It's very tiring. It's very nerve-wracking. You get very anxious, and you're going to go through an emotional roller coaster that you've never had. Have patience and grace with yourself. It will be okay. Have that caregiver. And like I said earlier, my faith helped me through that. And lastly, give your cancer a purpose. Don't let it define you, define it, right? My purpose was to use my cancer as a platform for HPV and prevention of HPV. And I was coaching 15, 16, 17-year-old boys. And I spoke very plainly and openly about HPV to those boys and and their parents, and they appreciated it. And I will tell you today that those boys still call me up and say, "Hey, Miss Tina, can you come to my graduation? Will you be part of my wedding? We miss you. How are you?" So give that cancer a purpose. Don't let it defeat you. You defeat it, because in the end, when you stand up and you say, "I am a warrior and you are not going to defeat me," you are going to the survival is just going to be so much more sweet. And again, thank you guys. It's been an honor, and I'm very humbled that I was asked to talk with you. And I look forward to your questions. a little later on.
Thank you so much, Tina. That was very supportive and inspiring and moving. We appreciate it. And I'm going to let Melvin speak next. Oh, I think you're on mute, Melvin. There you go.
Yeah, I guess that shows how nervous I am, but I'm going to break the ice and say I'm an avid pickleball player. So all you guys out there who are avid pickleball players, join in with me on this one here, okay? So I was diagnosed with metastatic squamous cell carcinoma when I was 58 years old, and that was in 2018. As mentioned before, it was done through a number of biopsies that was taken. I first observed a lump on the right side of my neck. I thought it was associated with something dental related or something that when I sleep at night, I bite the inside of my mouth, and I thought maybe a nerve had started to swell up. But it was latest. I went to my dentist, and he said it wasn't anything related to dentures, my teeth, or anything inside of my mouth. So the biopsies later determined that it was cancerous. The primary was located at the base of my tongue. It was approximately 2 millimeters in size, somewhat undetectable, very undetectable by the CT results. They had to look real closely to find that out. I went through radiation and chemo, very similar to what Tina has mentioned about having the mask being fitted on you. At first, that is a somewhat, I would say, not so much scary, but intimidating, because the mask fits so close to your face that if you move your eyelashes, you can feel your eyelashes touching the mask. So just remain calm. I had thoughts of, life and death that kind of calmed me through those moments there. Again, as Tina mentioned, trusting in my faith as a Muslim. So I did about 6 weeks of radiation, and then I had chemo once a week. It went a little longer because approximately about 3 weeks into my treatment, I found it very difficult to eat. I can recall trying to swallow water. It was so difficult by allowing the water to run on the sides of my cheek into my throat because it was so severe. And what happened was that that day I ate some blueberries, just trying to get something inside of me, and I started throwing up. I threw up once, and then I saw the coloration of what I threw up, and it looked like blueberries. And then I threw up again, and I realized that it was blood. So my wife rushed me to the hospital, and I was diagnosed with severe malnutrition because I couldn't eat. Let me back up again and also mention what Tina mentioned about skincare. It's very important that you maintain that skincare. It's going to look like, even maintaining it, it's going to look like a severe burn, but you still should keep the skin cream on, maintaining it. When I was in the clinic, I saw an older gentleman who wasn't maintaining his skin, and it really looked very bad. It started peeling and so forth. So my wife was very supportive and having me to daily put on that skincare. When I was when I was diagnosed with severe malnutrition, they had to insert a feeding tube. I must say something about nutrition. Sometimes your nutritionist will continue to tell you to eat, but sometimes it became difficult. She kind of made it like a warning or a consequence, but I do believe that getting a feeding tube could be a necessary thing. It's not something that if you get it, you've done something wrong. No, I believe that I needed that in order to continue to sustain my life at the time. Um, and just like Tina, I lost quite a bit of weight, shirt sizes, pant sizes, all that had to be changed. A whole new wardrobe had to be bought. So I spent the 4th of July in 2018 in the hospital recovering from the surgery. I also must mention that as I continued the radiation and the chemo, as mentioned earlier, your saliva glands will begin to act up. It acted up so much for me that I would go through a box of tissues in one day, trying to remove the saliva from my mouth. Now, I was able to maintain an at-home work schedule, but when the excessive saliva started occurring, I had to cancel many of my meetings because I couldn't talk at all. I had to have other people kind of carry the meeting for me. The radiation and the chemo ended around July the 25th, 2018. But I had to continue with the feeding tube for about another 6 weeks until I can consume around 1,500 to 2,000 calories. And I can recall one day eating chicken noodle soup, and I tasted it as opposed to tasting metal from the chemo. And I recall crying that day that I was able to have a bit of taste. Some of the side effects today, from a body point of view and my athleticism, I believe I returned to some degree to what was normal for me. But swallowing is still a little difficult. I can get it down, but I know that I have to drink. I'm not sure of my taste buds anymore. I had COVID, and whether or not that took some away from my taste buds, I don't know, but I can still appreciate food. So all of you remember our color is ivory and burgundy. That's our color of head and neck cancer. I've been wearing this band here since my kids and them purchased it for me. So if I can say anything, I say that God doesn't give us, He doesn't put us through situations unless He wants us to gain something. So look at it, He doesn't give us anything beyond what we can endure. So believe in it in that way, and hopefully you will be as successful as I am, because I'm very honored to be a part of this panel today. And many thanks for the Alliance for selecting me.
Thank you so much, Melvin. This has been a really valuable discussion and lots of insight. We've had several questions come in, so I'm going to address a few of those. This one is probably for Dr. Rich. What are some theories, if any, for the etiology of non-HPV squamous cell carcinoma of the oral cavity in non-smokers, non-drinkers?
That's a great question. And the answer, unfortunately, is we don't know. So there are some conditions that can predispose you. Somebody had asked a question about lichen planus. Most patients with lichen planus have a low risk. I do have patients that have erosive lichen planus, which is a very aggressive form. And one patient in particular has had multiple mouth cancers despite never smoking. So you definitely want to keep your lichen planus well controlled. If you have any spots in your mouth, please keep an eye on them. I usually tell patients, take a look at them once a week. If you can't even take a picture, don't look at them every day. It's like watching grass grow or your kids grow. You can't tell a difference, but just, once a week, once every 2 weeks, keep an eye. And if you notice any changes such as growth, getting larger, getting taller, changing colors, pain, bleeding. Those are things that you want to see somebody about. There are some patients have just this disposition. Unfortunately, what we see is oftentimes those that have mouth cancer that don't smoke, it's usually women in the kind of 60 to 70 year range. We don't understand why. We see another spike at that age group, in that demographic.
Thank you. And a question for Tina and Melvin. What was the most helpful thing that you were told about your treatment plan early in your diagnosis?
I think for me is that they said to me, we treat this type of cancer all the time. You don't have to worry about it.
Mine was similar. I had a staff in my cancer treatment center that had all experienced cancer themselves or had a family member that had had cancer. And Dr. Garrett just looked at me and he said, Tina, we're going to walk you through this. It's going to be okay. And knowing that they had the similar or the same experiences that I was getting ready to have made it much more easier. And it made it more meaningful to go through it with that staff because they knew what was coming my way. So that was the best advice I received.
Thank you. And another question that could be for anyone really is loss of short-term memory. Can that be a side effect of chemo?
Yes, it can.
I can tell you I didn't have chemo, but I have trouble at times pulling words out of my mind. The right words just don't come. And it was a result, I think, of the radiation. It's not often, but when I'm in a meeting sometimes and I'm talking fast, the words just won't come. And I have to be comfortable in the pregnant pause that occurs.
Are there any recommendations for trismus? Is it common? This person in particular has done some exercises, but hasn't seen much benefit.
Yeah, so I can answer that. It depends oftentimes on where your cancer is and what treatment you've had. Usually for like throat cancers, we don't see it as often as we do if we're treating upper jaw cancers, lower jaw cancers, or towards the back of the throat. Again, though, what's important, I always like to tell people it's use it or lose it. It's better to maintain than regain. So if you're having trouble with anything, whether it's trismus, neck mobility, swallowing, you've got to really stay on it. It becomes a daily ritual where you have to do those stretches, those physical therapy, the lymphedema therapy, sometimes even forcing yourself to eat when you don't feel like it. And that's kind of part of the new norm. And they've done studies that show it doesn't matter where you're at in your treatment, preferably better, earlier on in your journey. But if you will do that regularly and consistently and take the time to invest in those therapies, whatever it may be for your particular case, you're going to have better functional outcomes than if you don't, or you're kind of spotty off and on.
Amanda, can I jump in for just a second and circle back to a question?
Mm-hmm.
One of the other pieces of advice that I got was to see my dentist more regularly. Every 6 months, you're supposed to go normally. My doctors recommended that I see my dentist more aggressively because teeth are highly affected by radiation and chemo. So make sure that you have aggressive visits with your dentist, and make sure that you tell your dentist that you have had head and neck cancer, you're a survivor, and that you have had your treatments, and they look at you a little differently and they're more thorough. So just be aggressive with that. I would highly recommend that.
Can I add to that? There were some questions about osteoradionecrosis or radiation damage to the jaw, and I think this dovetails well to what Tina was mentioning. As she said, that teeth can be affected with radiation. So if you need a tooth pulled, it's important that you talk to your surgeon or radiation doctor before it's done, because many times we will recommend hyperbaric oxygen be given before and after a tooth extraction to help that socket heal over. Because sometimes if you've had radiation and a tooth is pulled, it won't heal, and you're left with a hole that goes into the jawbone, and you can get a chronic infection. Also, don't let any dentist, tell them you've had radiation, don't let any dentist do any procedure where they peel back your gums for any reason. Never, never, never. I've seen this too many times where dentists, endodontists don't realize that somebody's had radiation, so they treat you like a patient that has it, and they'll do teeth pulling, they'll pull the gums down to try to access the roots, and that will kill your jaw. Now, osteoradionecrosis is an infection of your jawbone. And usually it's a late term effect. Not everybody gets it, but some people do, especially if you're still smoking. So please don't smoke. But what happens is the jaw above or below, wherever your radiation is, you can start to see some deterioration of the jawbone. You may have some open sores in the mouth that expose the bone. It's important to get treatment. There's lots of different treatments for it. Usually here, we don't give hyperbaric oxygen anymore for when you have osteoradionecrosis. I haven't found it to be helpful. There are some medications. We use what's called the Pentaclo protocol that works in a lot of patients. It's long-term medications for months that tend to help rebuild the bone. Sometimes it can get so bad that you can have your jaw can break, where then your jaw would have to be replaced with the bone from your arm or your leg or your back to reconstruct that. So it's I think I've scared Tina. I'm looking at your face there. I don't want to scare you, but it's.
No, I'm glad you said that.
It's important to take care of your teeth and your jaw. I know that there were some questions. There were some people had mentioned some of the long-term side effects of radiation and some of the frustrations with that, and I hear you. And I'm sorry to hear all those. Radiation is an essential part in killing cancer, especially advanced tumors. So oftentimes surgery alone can't do it. We need radiation. But the longer you live, the more side effects you can have as the tissues scar down more and more. So some of them are preventable, some of them are not, but it's important for you to stay close, even if you're out of that 5-year range. It's important to stay close to your healthcare team so that you can address these issues as they come down the road. And I know we had some people that have lived 20, 30 years past their treatment diagnosis, which is great. And I've seen that many times, which is wonderful. But they also complain of very severe side effects. And I've seen that many times, and we don't have any treatment, unfortunately, to reverse that. Yeah.
Good information. We had a couple questions related to scar tissue. One person noted that after a neck dissection surgery, there's quite a bit of scar tissue under the chin, which is uncomfortable. Is there a way to minimize scar tissue?
Yeah, so let me group in that scar tissue and lymphedema together. Then there were some questions about lymphedema. So whenever you've had surgery or radiation, you can get scar tissue in the neck. And chemotherapy oftentimes chemotherapy accentuates the treatment, the effects of radiation, which is why we give it to help kill the cancer cells better, but it also accentuates the side effects of radiation. So if you get chemotherapy with radiation, usually your effects are even worse. But that stiffness and scar tissue can often be from fibrosis or scarring of the skin and muscles, lack of blood supply. And so oftentimes massage therapy, rubbing those areas, neck stretching can go a long ways. if a certain area hurts, I often tell people to rub it even more. Now, don't go crazy on this, but sometimes if something hurts, we just don't touch it. We try to stay away from it. And the brain doesn't get used to that. So oftentimes if there's one area that's a little tender and your doctor has told you, look, the cancer's not back, and it's like on a scar, I usually recommend patients gently rub it more to kind of desensitize that area. So your brain, it's like when you're wearing a tie or something tight, your at first it's bothersome, and after a while your brain gets used to it and just accepts it. Now, after surgery and radiation, many times people can get swelling in the neck. That's called lymphedema. That's fluid that is stuck in the tissues. You all probably have had times where your rings may or may not go on or off, or they're loose. Our bodies swell and shrink all the time. That's part of being a human. When you've had treatment, it's easy for your body to swell. It's hard for that fluid to leave the tissues. And so you're left with this swelling, and you can see it externally. You can also have it inside that you can't see, but it can affect swallowing. So lymphedema is a very important therapy. And somebody had mentioned that it's probably not diagnosed or not recommended as often. And I agree. It really should be. I recommend it all the time. And the sooner you can start it, the better. If you can even start it before radiation and then do it as much as you can during radiation, it's even better. But it's never too late to start. And these are exercises where you help push the fluid out and down so it can get down into the rest of your body. There's also machines that do this well. The Flexi Touch is probably the most famous one that's out there. It's a customized wrap that goes around your head and your neck and your upper chest and sequentially squeezes areas to try to get that fluid out. So I would talk to your doctors about lymphedema therapy and even a Flexi Touch to get in touch with that company.
Thank you, Dr. Rich. And we had a question for Melvin and Tina. How long did it take you to be diagnosed from the start of your symptoms or beginning?
I will tell you that I watched my tumors for 6 months. And on the week of July 4th, I had a massage, and my massage therapist did lymphatic work. My tumor doubled in size overnight and shot pain back and through my neck. That week, I had 4 FNA biopsies, fine needle aspiration biopsies. By July 29th, I had been sent to a head and neck cancer clinic in Indianapolis, was diagnosed, and in early September had surgery.
Yes, for me, it was within 15 days. It was a matter of me taking the actions I felt was necessary. I prolonged the lump it just continued to grow and grow. And then I took it serious. In my community, many doctors in my community, I inquired with them, went to one neck surgeon. And I think that the needle biopsies, you want to get as few as you can. After getting so many, you kind of get needle shock, But within 15 days after going to 2 doctors and then going to MD Anderson, I was diagnosed. And that was only because of my delay, kind of. If I went to the dentist this week, then I didn't go to the first head throat doctor till last week. I had to wait for the results. I got the results, then I went. So it had something to do with getting the results back, but my movement within 15 days.
Thank you both. One patient notes that they are past completion of 33 radiation sessions for HPV-associated head and neck cancer, and that saliva is still nonstop and on a liquid diet due to throat being sore and difficult swallowing. When can I expect to see improvement in moving back to solid food and taste buds returning?
I still don't have any saliva, and it's been 6 years. But my taste buds came back within a year and a half. And it took me about 1.5 to 2 years to be able to, if you judge anything, to eat a piece of steak and or a piece of chicken. And it's still very hard for me to process unground meat. So those are some of the side effects I have.
My radiation time was shorter. So if I try to eat something very dry, then it doesn't get lodged, but it just slows down a bit. That's all. Enough time if I wanted to grab some water and then finish it up.
Yeah.
So I say my time period radiation was shorter. I recovered a lot quicker. It wasn't a significant time that, you know, like Tina is realizing this is not occurring. It occurred quite quickly for me to be able to taste, to be able to swallow. So for me, if you're at the 6 weeks of chemo and radiation, you have that, then recovery is good. I don't know taste buds. I don't remember taste buds from when I had them, when they were regular to when they're irregular now. I don't know the difference. We should value the taste, being able to taste, because now I don't know what's normal or not anymore.
Thank you. There was a question about whether to monitor carotid function, sorry.
Yeah, I just typed an answer to that.
Okay.
That's a great question, because over time, this is again one of those long-term side effects of radiation therapy. To my knowledge, there's no set guidelines of when or how. If you start having any symptoms of strokes or mini strokes, such as TIAs, then definitely. If you're prone to atherosclerosis, I would have it looked at, or you could just talk to your doctor preemptively and ask about that. The best test is a carotid duplex, where they look at the flow of your carotid arteries. And then, so if there's any concern about that, I would talk to your primary care doctor about getting a carotid duplex.
Great. And another question really for Tina and Melvin were what resources or support you found that was helpful, either at your clinic or with other groups.
I'm sorry, I was reading something in the chat. What was that again?
Oh, this question was about what resources Melvin and Tina found helpful in terms of support along their journey, whether through their clinic or through, you know, other organizations like ours or in your community.
I will tell you that my care center, Dr. Garrett's staff in Indy, was invaluable. All the support that I got for my cancer journey from a medical standpoint was there. I would implore each of you, and this is very, very important, have a caregiver that you trust in your life. I have a girlfriend that went with me to every treatment. Have someone that you can lean on, and to know that if you have a question, they can ask the question for you and they can get the information from your doctors. It's imperative that you have that. Without that, any resource that I may or may not have had access to, I may not have gotten the information, because there were times I was so tired that Barb had to go do it for me. So I would really say have someone that can help you that much.
Yeah, I must say the same, because we're at MD Anderson, you know, they're known for their care, and I believe I had some of the best doctors there. I do believe my wife helped me to stay on course, because she was the one driving me every day to get my treatment and reminding me. I must also shout out to the Shell Oil Company, because they didn't ask anything of me in terms of coming to work. They have an emphasis for care, and they wondered why I showed up for work. So a lot of these emotional, financial, transportation difficulty, people being available for you. I didn't have, and alhamdulillah, I'm blessed and I'm fortunate. I just had to go through this. I didn't have a care, neither financially. I must say, the reason I pursued this so quickly, I must say, because Shell has a program with MD Anderson for any oncology, that if an employee has any, through United Healthcare, if an employee has anything related to oncology and we were attached to United Healthcare, there is no financial cost whatsoever. So I had no reason to delay going to MD Anderson. I must say they made me pay $329 for the fluoride trays. About a year ago, I got $329 back. So those support, the external supports that you have from your employer, from your family, and the care, they give you lots of pieces of paper. I may have got 100 pieces of paper, but I only want to read that was concerning me at the time, what I was going through at the time. Read right there and then hold everything for later. I didn't go through everything, but they gave me a lot of information, and they stayed on top of it a lot more than me. I must say that I did have some, I was self-conscious about my weight. One thing that I was hoping that when I go to get weighed, that they didn't ask me to take my shoes off, so that my weight could show that I wasn't losing weight. And I'm an athlete. I lift weights, and I slowly started seeing that I was losing the muscle. But the folks around me who, I think at the radiation center knew, made me comfortable, kind of cleared that, that anxiety I had in that area. But I believe it's the people around you, and because there's a lot of things to take care of. Who's going to take you there? Your finances. What about your job? Is there anybody to leverage? You can leverage with. So the more people you can have to leverage with, the better.
Thank you. And I'd just like to note, as we get close to the 6 o'clock hour, I know some will have to drop off now and wrap up, but this entire webinar is being recorded, and we'll have it available on our website. Some of you have asked, so the slides and everything will be there. I'd also like to mention a few of our support programs at the Head and Neck Cancer Alliance. We have a peer-to-peer program, which is for both survivors, patients, and caregivers who can sign up and get matched with someone just to talk to who's gone through similar experiences. We also have various educational webinars like this one that are on our website, resources for nutrition and eating, and a variety of other programs. So we hope that you'll visit us at headandneck.org and reach out. So there are a few other, it looks like all the questions have been answered in our Q&A. So I am just going to wrap up today with thanking our panelists. They have been excellent, both in terms of sharing your stories and being vulnerable and open with everyone. And Dr. Rich, your expertise in this area, especially for patients going through a head and neck cancer diagnosis now and over their first year. And I would just like to thank all of our participants and thank all of you for joining us and sharing in the chat and your questions. And we look forward to continuing these conversations.
Thank you.
Thank you, everybody.
Thank you.
Thanks,
And have a good
everybody.
evening.
Bye-bye.
It's the first one you ever did, Tina?